Across America, there's a significant shortage of child and adolescent psychiatrists. Our state of Wisconsin is no exception, as we have only 148 child and adolescent psychiatrists, and 48 out of our 72 counties are without a child and adolescent psychiatrist, showing a clear need for expanded mental health services for our pediatric population. In many cases, a primary care provider can handle routine child and adolescent psychiatric cases. But what happens when children experience a complex mental health situation that is beyond the primary care provider's scope of training? Does the PCP send the child to the emergency department or hospitalize them? Do they use trial and error with medications and differential diagnoses? Or do they try to refer the patient to a child and adolescent psychiatrist, where the wait time for these patients can often be up to 3 months? No child should have to wait that long, and many can't. This is where programs like the Wisconsin Child Psychiatry Consultation Program come in. The role of the Wisconsin Child Psychiatry Consultation Program is to provide phone and email consultation requests to primary care providers across Wisconsin. In addition to this, they also provide educational opportunities to primary care providers through the program. To determine the impact of Wisconsin CPCP on diagnostic decision-making and patient outcomes, we surveyed PCPs after each consult. In 68.7% of surveys, providers agreed or strongly agreed that the consultation forestalled a child psychiatric referral or hospitalization. 70.5% of providers thought they made the correct diagnosis or medication change earlier than they would have without CPCP. And 46.5% of providers thought their consult with CPCP reduced the risk of self-harm and/or suicide. When asked about alternatives to Wisconsin CPCP, with 48.3% of surveys, the most common answer given was to refer to mental health, which, as we know, could take several months compared to a phone call that same day. Our survey results show that primary care providers believe the Wisconsin Child Psychiatry Consultation Program is a valuable resource in helping manage complicated child and adolescent mental health cases and improving patient outcomes.